To start very soon. Okay, it's time. Let's go. So today we're going to talk about getting ready to for Medica in 30 days. And so Medica starts on the 13th of November. So we just have a month to be ready. Today I have one of my guests. If Carmen, you could just wave at us and make a sign, and we'll put you on. We'll put you on when the time is right. We'll have a section around lead generation. That's why we have the head of lead generation at Exportia, who is going to be with us today on the Exportia Lab. All right, let's go. So let's get ready for Medica in 30 days. So you are about to head to the largest medical trade show. Hi. Good to see you. So that's Carmen, the head of lead generation. She's joining in a little bit later. You're about to head to the largest medical trade show globally. That's great news. And to make the most of it, we are going to help you prepare. But I think let's reflect on a few what other exporters, medtech manufacturers, and e-health software developers have said about Medica before. When I did a round of interview of exporters from around the world going to Europe to sell their product, when I asked them and reflecting some of my work with one of my latest books, is that those companies that are attending Medica, what they say, after a few years is that's probably where they made their most strategic business relationship with the distributor, where they, made some very good collaboration. So this is a strategic show for you if you are in medtech. So my name is Christelle Damien. Some of you don't know me. I'm the founder and director of Exportia. I have 23 years of business development experience in Europe. And together with my team, including Carmen, who is with us today, we have a track record in scaling non-European businesses to multi-million euros in sales. We have a lot of experience in setting up, managing European distribution network, and also at establishing sales teams worldwide. If some of you are not aware, I also write books about our methodology. The second book is the 4 Steps to Generate Your First €1 Million in Sales. And it won the Best Australian Business Book in Sales. And the next book is coming up early 2024. And it is a collection of export stories from around the world. All right, we provide an outsourced European sales and marketing team, and we help businesses scale to their first €1 million and go beyond. This is a team you see here. We have Carmen, who is going to be with us today, the head of the lead generation team. We have 2 offices, and the majority of the team at Exportia is based in Europe. We're half German, half French, but we speak also, we have Spanish, Italian, Dutch as well in the team, and more. We're a team of 10. Exportia France also offers a service specifically for medtech, so that's why I'm mentioning it to you today. We provide an EU authorized representative service for companies that want to comply with the MDR and need to have a local authorized representative in liaison with the local competent authority that they can hold all your technical files and documents. So we do that service. And all across the last 17 years, the reason we are very experienced and we're holding this webinar is because in the last 17 years, We worked on about 18 healthcare projects, medtech, biotech, and we've been exposed and worked with university hospitals, with government labs, with private labs, with emergency services, public health department, institutes, research institutes, pharma industry, so very broad range. So that's why we can talk about that today. That means that we've been exposed to a lot of different specialties, whether orthopedic surgeons, ENT, anesthesists, dentists, infectious disease specialists, microbiologists, lab technicians, you name it. Okay, why are we sharing and doing this lab about Medica today? Well, it's quite overwhelming. 81,000 visitors, it's quite overwhelming in 173 countries. This is an overwhelming figure, of course. So, and it's important for companies that are making the investment to either visit or to attend as an exhibitor to make the most of it. The other reason is because Medica is a distributor show, you need to be ready for that. The reality about Medica is there's a lot of exhibitors. The exhibitors a lot of them are manufacturers, and the visitors coming as a vast majority are medical buying groups, or they are actually a lot of them distributors. So be aware of that, be ready for that. It's not a show where so much you're going to meet your future key opinion leaders that tend to go to specialized conferences in their own field rather than going to Medica. But you can see here, you may have a few hospital care facility, physician's office, laboratory and research science. You may have as well a little bit of that, but it's not the majority. Our journey today, we're going to talk about knowing your country of priority before you go, pitfalls of European distribution, 5 steps for high-performing distribution network, ability to generate leads. That's when Carmen is going to join us again. And on your booth, what should you do on your booth? The follow-ups and preparing for next year, because that's quite an important step as well, especially for the ones that are also planning to attend next year if they're not going this year. Let's start with knowing your country of focus before you go. I think it's very important because it's so overwhelming. You're going to have 173 countries represented that are coming to your booth. You need to be very clear of what you're looking for, and you need to prioritize. And you need to really make sure that you focus on connecting with these Europeans, especially if you are on the booth in a pavilion. Make sure you get out of your way to mingle with European targets, because staying just within the pavilion might not help you. You may have to get out there and try to meet European targets. So be very clear in which European countries are your priority. Of course, Germany is the main country present, so definitely if you are targeting Germany, you are in the right place. There's no doubt about that. But there's other countries that are extremely well represented at Medica from European countries. A lot of visitors come from the Netherlands. A lot of visitors come from Italy, the UK, France. So be very clear on which country you're going to focus on. So question to you, which European country is your focus? Most of you would focus in Germany, and that would be the right place to be. All right. Number 2, pitfalls of European distribution, setting up distribution. All right. You're going to have distributors coming to see you. You may meet distributors at Medica while you exhibit. When you are negotiating with distributors, just hold on, take a step back, and don't systematically accept exclusivity. In our experience, for small and medium-sized high growth businesses, granting exclusivity has not really helped our clients achieving more. It's rather has been the contrary. We find it's a bit risky for a small business to grant exclusivity, even with KPIs and with a lot of protection for a business. If it doesn't work, it's very long and hard to unwind. So we would not recommend that option. Also, when distributors come to you, which will be the case, you're going to have some coming to see you. It's much better to allocate to them one country at a time, let them perform, and then you can extend. Going straight away multi-country, you're not guaranteed they actually have the capability to do it, because you don't know them, you don't know their capability. So I would not, we usually advise to go one country at a time with a distributor. Easier for you to support as well. Don't let your distributor cut you off from your end users. It's not because they are your distributor that they own your customers. It is their customer, of course, but you have to maintain direct contact with your end users. One of the reasons that you should do that is also for compliance reason. We are in the medtech industry, and therefore we need, for compliance, to have access to our end user. It's very important to be able to gather feedback and intervene if need be. So it is important, and we can't let our distributor wanting to own the direct contact with end users. Of course, you won't be able to reach out to all your end users, but you need to be reachable and you need to have access to them. All right, let's go to number 3 in our little sequence. It's about framing the discussion with the distributor when they come to you on your booth. Let's go through the 5 steps. All right, it's about profiling the right distributor, selecting them, engaging with them, activating them, and managing them. Let me go through that. Profiling. So they need to have the type of clients you're looking for, whether you target our GPs, endocrinologists, or orthopedic surgeon. You need to make sure those distributors are actually visiting those targets 100%, and they're not intending to go into that market. No, they need to have this type of clients already to make it easier for you. What type of competence, skills do they need to have? Nurse educators, after sales service, do they need to have a technical support that you would need? You know, what role should they play for you? Be very clear about that. Do they need any specific certification? Do they need to hold any complementary product to yours? So profile. 2, select. Do a full selection. So when the distributors come to you to see you on your booth, you, of course, are going to make sure they match your preferred profile. You're going to ask them a lot of questions. But what you should also do is make sure you let them know that you are assessing the several distributors. You are doing a full landscape analysis. You're very honored that they're coming to you. You definitely want to talk to them, but you are also assessing the full landscape. All right. Conduct a selection. Engage. We said it before, non-exclusive basis, one country at a time. And then you need to talk about KPIs in terms of activity. Activities is, I don't know, type of customers they will focus on. How many visits? Activity drives sales at the start. So rather than focusing on the sales target, it's good to focus on activity in the first instance. Of course, you will improve the terms and conditions with those medtech distributors as they perform. Activate, very important part. That's where we're going to talk to Carmen about lead generation. Activating, we call it activating that step internally at Exportia. It's about training the sales team of your distributors. So when you may even visit distributor booth, you will see reps there. So you need to, we have some clients, for example, that use Medica to be on the distributor booth, to work with the distributor and to train them. It's a great way to train a distributor sales force. So train the sales team is important, generate leads for them. sell with them, support them. You can even, navigate between your booth and your distributor booth at Medica. It's a great way to get them active. All right, manage. Report back to management of the distributor and say, oh, this is what we've done. We've generated 10 or 20 leads for you. Where are we at with those leads this month? And you really have regular leads and account review. Any price increase when you needs to be notified 90 days to your distributor, they need to be informed. Otherwise, they will ask you to implement the increase in 90 days if you ignore that delay. Okay, so we've done the 5 stages, the 5 steps of a high-performing distributor network. And now we are going to talk about an important key, which is the ability to generate leads. So I'm going to ask Carmen to come up online. Hello.
Hello. Can you see me? I'm fine.
Well.
Thank you. Thank you for having me today.
My pleasure. So you conducting a lot of our lead generation campaigns. I need to show you what the photo we've put for Carmen. You have to know she's a girl in lead generation. I had to do this. Sorry, Carmen. All right, let's go back. Carmen, please can you tell us a bit more about lead generation in medtech and some of the specifics of that sector when you conduct lead generation with your team at Exportia?
Yes, of course. So same as in other sectors, end users and channel partners are constantly looking for new technologies and solutions to ease their workload and to improve workflow and achieve better results. Yep. But end customers, who are usually physicians and doctors, are usually hard to reach. So how to reach because of what? Because they are not available during consultation hours where they see their patients, hospital rounds, and during emergencies. So what the team does, the team focuses on creating a space of trust, which is based on active listening and respectfulness with all the people involved that you may be talking to, who may be the secretary, the receptionist, the assisting nurse, the colleague, and or in order to understand what the best time for engaging with the prospect would be, what their internal processes are, who the correct contact person is, because in bigger hospitals, they have usually a doctor in the department responsible to assess new products. Sometimes it's the purchasing department, and sometimes it's someone else you need to contact first in order to open the doors. Yes, and of course you need to respect their privacy. And how can I say, need to know when to follow up, when to engage with them, and when the best time to schedule a meeting would be. And of course, the team is perfectly aware that they will need to be persistent and patient and persistent.
Yes, and respectful as well. We talk about GDPR after, because I know you're following a very strict process, and we are as a business at Exportia, of course. What would you recommend to a manufacturer in the medtech space that is new to the EU market? What should they do first? What would be your recommendation?
Mm-hmm. Although the medical sector is governed by the EU, each member state has its own specificities, its own regulatory authority, approval processes, healthcare system, and as well as reimbursement system for patients and doctors. So what I would like to recommend is to focus on 2 or 3 EU countries first, which look very promising based on public available data, and then to conduct a market validation campaign, because by contacting your end users or channel partners, you will receive the you will receive the real and current feedback about how can I say,
The government
certification processes, exactly, governmental programs, differences or changing in laws. So the best, or how can I say, if you're contacting those 3 countries, you will definitely find out who or which country will have the biggest appetite for your technology or product and the less entry barriers.
Yeah. Can you share with us, because that's also important. I mean, we talk about it in the next two points, but your process for GDPR to make sure you're compliant with the team.
Yes, based on GDPR and based on the regulations the EU defined for GDPR, we need to call first. So our first reach, our first activity is to call the company and to ask for the right contact person to engage with. Then if it's possible to speak to the contact person right at the first call, ask for their consentment in terms of sending information via email. And then if we may follow up in order to receive their feedback or opinion about the product or solution we are offering. This is very important for the EU.
Yeah, great. Thank you for that. So we'll keep you in the line for a while, and in case we have any question, I may have one more for you, as we're lucky to have you. All right. Thanks so much, Carmen, and thanks for tuning in. All right, next 2 points we have. Let me check the time. Yeah, we have a few more minutes together. All right, on your booth, what can you do on your booth that will help you maximize the exposure? All right, that's number 5. So who do you need on your booth is a good question. I mean, you have a small booth, you don't want to have too many people because you want to be inviting. You want to have people to come to your booth. So if you have a small booth, just being 2 might be enough. Of course, it'd be wonderful to have a German speaker if you can. You can have us, invite us, we can support. But more seriously, it's important that you have the people that are well prepared, that maybe have lined up appointments and that have the preliminary contact. We're assuming you're new to Medica in this lab, but if you're well aware of Medica, it's important that the person who's managing the day-to-day contact will be at Medica. That goes without saying. A limited print of brochures is great. One of the reasons why we also recommend for you to know your priority countries is then you're going to make sure you're going to have the brochures in the right language for them. So if your priority countries is Italy, France, and Germany, you're going to have those 3 a limited batch in paper print. We recommend a little bit of print, but the goal is definitely to have a QR code to download for people to download your brochure on the landing page. I think that is a very that is definitely a very useful. Everybody are used to it. They don't like to carry so much. So that's highly, the QR code is great. So easy to set up. Organize your records as you meet a new person. So you're going to have visitors, you're going to prioritize them. We like to go, our process is prioritize 1, 2, 3, or 3-star, 2-star, 1-star, and categorize them. Each contact, when you scan their badge or when you record, keep their business card, you're just going to need to categorize them. Are they end users? Are they distributors? Because your follow-up will be different, of course. Are they a prospect or are they a current customer? That's also quite important. So you kind of categorize each contact that you've talked to, make your notes, know what the action is next. Plan for GDPR. So you're going to have a flow of incoming visitors. It's time to tidy up and ask for consent when you talk to people and let them know you're going to send them an email to ask them to opt in to a newsletter or to your database. So make the most of it. You're going to have a lot of people coming, ask them on the spot, Would you like to receive regular updates? Okay, so I'm going to send, you're going to receive from us an opt-in email. Can I send you invitation to our events? We are launching a new product. Can I send you an information? So that's when you make yourself compliant. It's a great way to do it. Talk to your peers. Trade shows and Medica are an amazing place to gather market insight. So if you have a market, if you have a neighbor exhibiting and you start to mingle in quieter times, which I strongly recommend, go to see a booth and meet your peers and colleagues that are doing the same job as you. When I was sales director Europe for some of our clients, I would always go and talk to the other sales directors, ask how business is, which distributor they use in which country, start to make friends, and you exchange information and you build your network in Europe. So very important to do that. That's also how you detect potential future recruits, because you see them in action. So I love trade shows for so many reasons. It's a great way to build your network. As a newcomer to the market, really useful. Leverage your show for your marketing content. Of course, do short videos. Hello, my name is Christelle. You are today on our booth and we are introducing this amazing product. And of course, if you have a native speaker, ask them to do it in German, ask them to do it in French. We've done that for a lot of our customers over the years. It works wonders. Take plenty of photos, interview your customers or your distributors, post live on social, and maximize your presence. All right, follow-ups, very important. Follow-up is critical, otherwise you waste your investment in Medica. Systemize your process. So a few things, you're gonna maybe hire a scan to lead little device. Every night you back up your records because they're reliable, but they're not 100% reliable. The other thing you need to check is when you scan somebody's badge, you need to make sure what data is in there, because sometimes you don't have a lot of data that is on their records, so sometimes it's not enough, right? So be CRM upload ready. So make sure that the data that you are collecting is formatted in a way that you can easily upload it and give it to your IT team to do that. Be fast in your follow-ups to maximize engagement. Those people are maybe a bit overwhelmed after Medica, but make sure you are, quickly on the phone. What I like to do, to be honest, if I can, at Medica with the very hot leads, I fix the next appointment already while I have them with me. So that's some of our tips that we do with my team. All right, systemize your process. The priority, the 3-star contact with the most important one, they're going to receive a thank you email, a brochure, a meeting proposal, a newsletter, subscription, opt-in, and an invitation to an event. So you prepare your system. We're big on system for small business. You prepare it before you go. That can be ready in the background before you leave the US or before you leave Australia or New Zealand. You're all ready to go. Okay, prepare that already. Why not contact us? We can help you to set up your meetings and to support you at Medica. Okay, you've done Medica. Let's say we are the 17th of November. Now it's time to also prepare for 2024. Can you believe it? Yes. Okay, just do your post-show analysis, number of leads. What was the traffic? How was the location? Was it a good location? Do you need to negotiate to change? Do you need to improve your booth? Do you need to, when you are dismantling the booth, can you see, did you detect a nice booth? Why don't you go and get the name of that booth manufacturer or booth agency? What was the quality of visitors? Were they good quality? Was there maybe more content, more pre-work needed to be done to line up more meetings at Medica? Okay, what went well, what could be improved, and should you register for next year? And where should you change hall or stay in your hall? All right, let me summarize the full session. Okay, know your country of priorities before you go. Very important because you're going to be all focused into talking to those people. Pitfalls of European distribution and distributors, exclusivity, multi-country, straight away. Don't do that. Go one country at a time and focus on their success. Ability to generate leads is a key for success. And Carmen has told us a lot about that. If you want to come back online, Carmen, you're welcome to do so. On your booth, brochures and organize your records, plan for GDPR as well, follow-ups to maximize the impact of your trade show, of your presence at Medica, and then plan for next year. Maybe there is also an early bird rate that you can get if you register early. All right, so Carmen, you'll be at Medica this year again.
Yes, I will be there and I will be happy to meet you. So if you would like to reach out, you have my contacts. I would love to have a conversation with you if you would wish for it.
Yeah, so you can contact us. So those are Carmen's contact. You can go on our website, reach out to us and meet Carmen at Medica. We wish you a successful show and we would love if you could share your success with us. That would be really amazing. We have not time for a lot of questions, but we can maybe take one. Let me check. Yeah, so Carmen, if you have, so let's say you're preparing, ideally, we're going to exhibit with a client at Medica. How long before will you start to organize the meetings for the booth? I think that's, how long would you rather have to be able to have a good number of meetings at Medica?
Best would be for us, the minimum is 1.5 months to prepare, but best would be to have at least 2.5 to make the most out of it. That's a good timeline, I would say.
Especially for the companies that are new, right? The ones that have no contact in Europe or are just starting, don't really have a database, don't have 2.5 is the minimum, right?
The minimum, yes. For those who have never contacted any customer or distributor before, we would need some time to cold call to understand who the contact person is, to share the information, to ask for feedback, and then schedule the meeting. If we have already active leads, then schedule a meeting is a little easier than if it's just cold. You know?
Yeah, because we need to work out what's the best, who are the best customers for them, you know, their profile. It takes a bit of time to work this out too. But it's definitely a great show, right? Because all the European distributors are coming to Medica to scout and to prepare their catalog.
They do. They do, definitely.
Yes, and they come from all around Europe to do that. So we would highly recommend any medtech business, e-health to definitely consider, and lab tech as well. I'd like to thank you for coming online, Carmen, be with me today, and I wish you a good trip to Medica. Have fun. I'm very jealous. And yeah, have fun. It's a beautiful show, and lots of success to you and to our customers as well.
Thank you very much. Thank you for having me, and much success to you too. Have a good show.
Thank you. Bye. Have a lot of success, everyone. Thanks.